Hey guys, welcome back to my channel. It's Jemecia, the nurse practitioner extraordinaire, and today we're going to be talking about obesity and why we're not talking about it as clinicians with our patients. As a provider, as a nurse practitioner, as a healthcare provider, you need to be talking to your patients about obesity, and if you're not, you are really doing a disservice to your practice. If you're not trying to treat obesity while you're managing diabetes, while you're managing hypertension, while you're dealing with somebody who has cancer, then you are doing a disservice, and you need to figure out how you can weave that into your practice. If you're interested in that, stay tuned. Hey guys, welcome back to my channel. It's Jemecia, the nurse practitioner extraordinaire, and if you're new to my channel, welcome. Guys, I am a family nurse practitioner full-time and an associate professor online, and I specialize in teaching nursing students, nurses, nurse practitioners how to become excellent nurse practitioners. You know, things that you might see in the clinic. I also go over health tips that you can manage at home and women's health. I really enjoy that. So on this channel, you'll get all of that, and you may get a few little tidbits about other stuff, you know, my natural hair, you know, stuff about me, about Jemecia. So today though, I do want to talk about something that's near and dear to my heart. You guys know that I love women's health, and I also like to talk about obesity. But here lately, I find that I'm talking about obesity in like a backdoor manner, and not necessarily talking about it like directly and up front. And I started to examine why we don't, as clinicians, talk about obesity as much as we should. You know, I can't say for everyone, but for the majority of us, there's several reasons. One, it's an awkward thing to talk about. And two, some of us are obese ourselves. And three, there's just not a lot of time in that slot to talk about the addition of obesity with our patients. But guys, as nurse practitioners, providers, PAs, doctors, really, it is our #1 priority to talk about obesity. And for me, while in my master's program, I studied obesity in children, but really, it's everywhere now. It's just everywhere. And so I was looking up some of the statistics that I do want to share with you about obesity, and I'll do that a little bit later. But the main thing is obesity affects everything, but we're just not talking about it, and we're not treating it on a day-to-day basis. And it's so important that we do talk about it. So I'm here to help you, kind of remind you as nurses, nurse practitioners, as providers, that obesity is very important to talk about, and we need to be talking about that with our patients as we're doing other things with our patients. It's kind of easy to weave it into our exams and our time with our patients, but you can't really just talk about obesity without having a rapport with your patient, or without having that good bedside manner, or that good ability to soften the blow when you talk about that, because it's very personal. But obesity affects heart disease, stroke, diabetes, hypertension, cancer, really everything. And so if we could get that one thing under control, we can get a lot under control. And if you know me, and if you're one of my patients, one of my students, one of my friends, family members, you know that I always talk about getting the obesity, getting the weight under control first. And once you can do that, you really can control a lot of the other things. And before, back in the day, we used to feel like diabetes could not be cured. once you get it, you have it for the rest of your life. That is not true. We are finding that obesity is so linked to type 2 diabetes, and if you can get that under control, you can get your diabetes under control. Obesity is linked to hypertension, it's linked to heart disease, and if you can get that under control, you can get those things under control. And I'm not here to tell you what to do, because I'm not your provider, but I am here to tell you that as a provider, as a nurse practitioner, as a healthcare provider, you need to be talking to your patients about obesity. And if you're not, you are really doing a disservice to your practice. If you're not trying to treat obesity while you're managing diabetes, while you're managing hypertension, while you're dealing with somebody who has cancer, then you are doing a disservice, and you need to figure out how you can weave that into your practice, okay? And somehow we've lost control of that. We've lost that art of talking about prevention with our patients, and I do believe it has to do with insurance and money and time and all of those things. But if we could just get back to that small thing about prevention, about health, about obesity, then I think we could really, really make a difference. And so I wanted to talk to you guys about that and bring it up. And I will be talking about this some more because it is very, very near and dear to my heart. So anyway, thank you so much for watching. That is all. Oh, statistics. Let's talk about that really quick before I go. So I went on CDC's website, and it said that the prevalence of obesity is 42.4% from 2017 to 2018. And the estimated cost that we spend on obesity is $147 billion and more, probably more now. And the medical cost for people who had obesity was $1,429 higher than the medical cost of healthy people. And of course, African American people are the ones, us, with higher rates of obesity for whatever reason. We are plagued with a lot of things, but I do believe that it has to do with socioeconomic things. It has to do with our diet. It has to do with miseducation. And yeah, so I'll talk about that in another video, but it says here that non-Hispanic Black adults are 49.6% who had the highest rates of obesity, and then Hispanics, and then non-Hispanic whites. So Hispanics had 44.8%, and non-whites had 42.2%, and Asians had 17.4%. And you know, you can really guess as to why. And as far as Asians having 17.4%, well, because their diet is almost plant-based. It's almost plant-based or pescatarian at best. So yeah, so that's that. Those are the statistics. If you have any comments to leave me, any video that you want me to talk about, leave them in the comments. Smash the like button, subscribe to my channel, and I'll see you in the next video. Take care, guys.